Hello everyone, good evening. Hope all are doing good and staying safe. So today's topic is on lungs. Yes, from university point of view, from your practical point of view, a very important topic. And this viscera is being spoken very badly by almost everyone because COVID is doing that much to the lungs, right? And because of this, you can expect this question this year. So pray for all those people who are suffering because of the infection, people who are in need of beds, right? It's very pathetic to see our country had gone this bad. So hope things will get better and we get back to normal soon. Yes. So with that, let us get on to the objectives of today's session. See, when it comes to anatomy of the lung, you have got only few information that you must know. But without knowing that information, it is very difficult for you to understand the clinical subjects. Clinically, lung is very important. You have got lots of respiratory disorders, tumors arising from lung. Right? When you get to second year, that is an important essay for you. So there are different aspects of lung that is very important for every clinical subject. But if you want to understand all that, yes, anatomy is important. So we are going to discuss only few side headings as external features, then root of lung, bronchial tree, blood supply, and bronchopulmonary segments. Usually I include only pictures. So even in this presentation, I have included most of the pictures from Google. I have tried my best to take some proper pictures and explain you. So just carefully observe all the pictures and the structures that are going to surround the lung. Yes. Now, this is a normal CT scan. Why I put this CT scan is just to tell you all, as this entire portion is the thoracic cavity. Yes, can you make out the vertebra? And these are the ribs that are here. So this is the thoracic cavity. Yes, and these two are my pleural cavity. Yes, these are my pleural cavity. So this is my pleural cavity. And this yellow shaded portion that has been given here, yes, this is your mediastinum. So what is this? Yes, this is your mediastinum. So we will be very frequently using the terminologies like mediastinum, the pleural cavity, thoracic cavity. So what you have to understand is mediastinum is the middle zone between two pleural cavities, which contains lots of structures, right? Important. No, heart is present in this mediastinum. You have got lots of vessels arising from the heart. So everything is present in the mediastinum. Yes, so that is why I put this CT scan picture. Now, whenever we talk about lung, the very first thing that you must know is the lobes of the lung. So you all know we have got two lungs, right lung and the left lung. One kind request is, now in the next slide I'll be telling you how to identify the side of the lung. That will be a gross discussion in your practical examination. Please do not keep this number of lobes and fissures as the primary point in identification. You're getting it? Please do not say this is right lung because I'm able to see 3 lobes and 2 fissures. No, these are not consistent observation, right? This is the first thing my anatomy HOD told when I was in first year. So please do not go with the number of lobes and fissures as the primary identification point. That's why I included this in the very beginning, right? So this is the right lung. Can you make out 2 fissures here? Fissures is basically a divisional line or a plane, right? So here I have got, this is one fissure and this is one fissure. So in the right lung, if you take, I have got 2 fissures and 3 lobes. So what are the fissures? Yes, this fissure seems to be horizontal. So hence this fissure is called as horizontal fissure. Yes, this is called as horizontal fissure. And this one seems to be inclined at an angle. So whenever something is inclined at an angle, I use the terminology. Yes, what is that terminology? Oblique, right? So in the right lung, I have got 2 fissures, horizontal fissure and oblique fissure, that divides my entire right lung into 3 lobes. Yes, what are the lobes? Yes, I have got a superior lobe, middle lobe, and inferior lobe. So you have to know right lung has got 3 lobes and 2 fissures, but you should not have this as a primary point of identification, right? And similarly, if you take the left lung is being divided into 2 lobes by a single fissure, and this fissure is called as oblique fissure again. And I've got just a superior lobe and an inferior lobe. So left lung does not contain any middle lobe because of absence of what? An horizontal fissure. So I've got 3 lobes, 2 fissures in the right lung, 1 fissure, 2 lobes in the left lung. Yes, very simple. Yes. Now talking about external feature. Now, this is the gross picture of the lung, and when you get to your college, your practical discussion is definitely faculties will teach you how to discuss the lung, but just have this idea. This is how the lung is present, right? Now, so far till in our lower classes, we would have seen the diagram like this. So we assume that lung is present like this, right? It has been no resting on something. No, the exact position is this. So it is like it has not been fixed on the x-axis just like that, rather it is getting inclined on the y-axis like this, right? So this is how we have to hold the lung. So what are the external features of the lung? So how will I determine the side of the lung? As very important. First, let us talk about the external features. So if you take the lung, as it will have an apex. Yes, can you make out a pointed structure here? This is your apex, and this one, as you have the base. Yes, you have apex, you have base, and you have got three borders. Yes, how to trace the border? Yes, I'm going to go along the perimeter. So yes, this is a border, then this is the apex, and this is another border which is on the posterior aspect, which is facing the faculty there, and this is another border, right? So totally, if you take, I've got three borders. So yes, what are the borders I've got? Is very important. This is my anterior border. Yes, this is my anterior border. This is my posterior border, and this is my inferior border. Yes, apex, base, anterior border, posterior border, inferior border. And along with that, it will have two surfaces. What is surface? Surface is basically the point of contact, right? You would have studied in physics. Similarly, if you take, yes, this is a point of contact, right? And this is another point of contact. So this surface where the examiner's fingers are resting, is that surface is called as the costal surface. Yes, that is called as your costal surface, because this surface of the lung is going to come in contact with the ribs, right? This is going to come in contact with the ribs, hence the name costal surface. And this one is going to come in contact with the mediastinum. If you observe this picture, so the lung is going to be located like this. So this is the costal surface that comes in contact with the ribs, and this surface comes in contact with the mediastinum. So I have got, this is the costal surface and this is the mediastinal surface. Yes, that is my mediastinal surface. So when they ask you to identify, how will you identify? Yes, apex should point upwards. What should happen? Yes, apex should point upwards, right? And then the border up, base should face downwards. Yes, we all know that. Then the costal surface should be directed outwards. This is a very important point that will help you to understand whether it is right lung or left lung. See, the costal surface here, it is facing outside in the rightward direction. So this is the image of the right lung. So costal surface should face outward. Mediastinal surface should face inward. Apex should face upwards. Base should face downward. Anterior border should face anteriorly, right? And its posterior border should face the student. Suppose you are holding the lung, the posterior border should be in the direction of you and the anterior border should face your examiner. So that's how you have to align the lung. So this is how you have to identify the lung. Very, very important practical discussion point. If you are given a lung specimen, the very first thing they ask is, yes, can you tell me the side of the lung? So you should not look for lobes and fishes. Please, I'm repeating this again. You have to look for the apex, base, the costal surface, mediastinal surface, the anterior border, and the posterior border. Yes. Now this is again a picture to show this. This is your apex, and this is your base. And which side of the lung is this? Yes, this is the right side of the lung, because apex is facing upwards, base downwards. This is your anterior border. This is your superior border. And this is my inferior border, and this is my mediastinal surface. Costal surface is on the other side, right? So this is the external feature. Now I am going to discuss in detail two external features. That is, one will be my apex, another one is the mediastinal surface. Both has got a very important clinical significance. Yes. Now, if you take, this is the apex of the lung. So this is how the lung is surrounded. Please understand, lung has got so many friends. It has got so many vessels, so many nerves, so many veins. You have got ribs. So it has got so many friends, right? So you cannot go and disturb it. If you're going to disturb it, yes, these surrounding structures will get angry and it will show its power to you, right? So yes. So this is the apex of the lung. Can you make out this green colored portion? This is the apex of the lung. So if you take apex of the lung, you have to know its relations, because the relations is what is going to play a very important role. So this is my anterior relation. Is whatever structures I am now circling, these are my anterior relations, and this is my posterior relation. Yes. So this is my first rib. So let us see its anterior relations. Now you are going to observe the picture. As I told you in the very beginning, just observe the picture, you will get the answer. Anterior relations. So I have told you what are the anterior relations, right? So this entire circle. So what is the circle containing? Yes, you have got a subclavian artery. You have got subclavian artery. Yes, very good. Then associated with this, obviously you will have a subclavian vein. And you have got a tendon here. Can you make out? Brown color is usually a tendon, right? This tendon you'll be studying in head and neck. This is called as scalenus anterior muscle. So you have got scalenus anterior, scalenus medius muscle. So the scalenus anterior muscle forms the anterior relation of apex of the lung. Yes, it forms the anterior relation of apex of the lung. And similarly, if you take posterior relation, so this is the anterior relation, very simple. This much you know it is enough. This portion will be taken again in head and neck. So there you will be able to understand even more structures, right? So as of now, I just told it very simple. Subclavian artery, vein, and scalenus anterior forms its anterior relation. If you look at the posterior relation, yes, this is the apex of the lung. So posteriorly, can you make out rib? Yes, which part of the rib? Yes, it is the neck of the rib. So posteriorly, if you ask, is posteriorly it is formed by neck of the rib. Very good. Neck of the rib along with certain structures. Yes, can you make out? You have got a yellow color structure. So I have got a nerve there. Blue color structure, a vein, and red color structure, an artery, and the star. What is this star? Yes, it is sympathetic ganglion. Yes, it is thoracic sympathetic ganglion. So you have got sympathetic ganglion. So we have completed what is star, and you have got a red and blue. So they are veins and arteries, right? So what is that? As it is posterior intercostal artery and vein. So first posterior intercostal artery and vein. Then that red color one is the ventral rami of T1. You would have studied in intercostal nerves, right? You have a ventral rami, dorsal rami, right? So the ventral rami of T1 is related to posterior aspect of the apex of the lung, and ventral rami of T1 also gives rise to brachial plexus. So even the brachial plexus will pass like this. Okay. Now, why are we very particular about relations? Especially the posterior relations are very important because of something called Pancoast tumors. And what is this Pancoast meaning? As it is referring to apex. As it is referring to apex. So apex, if the tumor of the lung involves the apex, then the patient is going to present with certain symptoms, and that one I refer to as Pancoast. Yes, it is referred to as Pancoast. Sorry for the spelling error. Yes, Pancoast syndrome. Yes, it is called as Pancoast syndrome. So what is this Pancoast syndrome? Is we saw the relations, right? You have got some nerves, you have got the sympathetic ganglion, you have got some vessels. So mainly the sympathetic ganglion, if it is, no, because of this tumor. So if you take, say, suppose the tumor is at this position, it will start compressing these vessels and the nerves. So what will happen? The sympathetic ganglion will not be able to give its outflow. So what will happen? It can damage sympathetic ganglion. So as a result, I have got some sympathetic functioning abnormality. So sympathetic system is not going to be activated properly. So I get some syndrome that is called Horner's syndrome. Yes, Horner's syndrome. Horner's syndrome. Yes, Horner's syndrome. So what is this Horner's syndrome? Now, it is characterized by very important your MCQ question. It will be dealt again in ganglion, sympathetic ganglion, as it is characterized by 3 symptoms. Horner's syndrome, first one, it is characterized by meiosis. What is the meaning of meiosis? As it is constricted pupil. So the diameter of the pupil will be reduced because of constriction. The second one is ptosis. What is ptosis? Yes, it is drooping of eyelid, watery eyelid. Okay, so that is drooping of eyelid. Then followed by anhidrosis. Sorry, ptosis is not watering, it is drooping of eyelid, right? So eyelid will be closed. That is what is called drooping of eyelid. Sorry, it's not watery eye, it is drooping of eyelid. So eyelid will close. Then anhidrosis, yes, there is absence of sweating in the face, right? So there is constricted pupil, that is meiosis, ptosis, drooping of eyelid, anhidrosis, that is characterized feature of Horner's syndrome, right? So that is one condition which is a part of Pankhurst syndrome. So along with that, now I told you brachial plexus also will pass. Can you appreciate here? Yes, it is blinking, right? Brachial plexus. So what will happen? The muscles of the forearm and the arm will be wasted. Sensation could be lost. So there will be some abnormalities in the arm and the forearm. Yes, and there can be erosion of the ribs since it involves, since you have got the coastal margins there can be erosions of rib also. So the tumor cells can go and erode the ribs. So there can be erosion of ribs. Right, so this is with respect to Pankhurst syndrome. So if you want to understand this Pankhurst tumor, you have to know the normal relations of the apex of the lung. That is when you'll be able to understand Pankhurst tumor. Right? Very simple. Yes. Now getting on to medial surface, that is another important essay question. Now, if you take medial surface, it has got two parts actually. The first one is the vertebral part. The second one is the mediastinal part. Vertebral part, nothing much significant because it is related only to the vertebra, but the mediastinal part is very important because it is related to so many mediastinal structures. So when medial surface is asked as a short note, you have to first highlight that it has got two parts, the vertebral part and the mediastinal part. Vertebral part is related to the vertebral column, but to the vertebra. Whereas the mediastinal part is, it is going to have an extensive explanation. So the right side of the lung has got some mediastinal relations. The left side of the lung has got some mediastinal relations. Now, this picture that is being put to you also in your textbook is depicting the mediastinal relations of the right medial surface of the lung, right? Of the mediastinal relations of the medial surface of the right lung, to be very simple. Now, so what are the relations? So how it is related is, can you make out all these structures that have been given here? So just start from this portion. So what is this? Is right atrium. So what is this? As I told you, the lung, if you get to the first CT picture here, or just get to this picture. So this is the lung, and here you will be having lots of structures that is related. So here I'll be having the mediastinum. So I'll be having heart associated with its vessels, right? And I have lots of esophagus, trachea, all these will be passing in the mediastinum. And this surface it is in contact with mediastinum. So it has got connection, or I can say connection, or it has got impression of the mediastinal structures. So the mediastinal aspect of the medial surface has got impressions of so many mediastinal structures because it is in close contact with the mediastinum. That is what we are seeing in this picture. So if you take, this is the mediastinal aspect of the right lung. Is what are the impressions that you can make out? Is first one is its right atrium. So along with the right atrium, what is the vessel that right atrium carries? Yes, it is superior and the inferior vena cava. So along with the right atrium, I'll be able to appreciate superior and inferior vena cava, right? So these are the initial structures. So with respect to the heart. Next one, what is the other venous structures related here? Is, can you make out? This is the arch of 𝗂𝒂𝒂𝒃 vein. So you have 𝗂𝒂𝒃, 𝗵𝒂𝒂𝒃 system. So on the right side, you will have the 𝗂𝒂𝒃 system. On the left side, you will have 𝗵𝒂𝒂𝒃 system. So on the right side of the lung, yes, you have got the arch of 𝗂𝒂𝒃 vein that forms the impression on the lung, right? Yes, it forms the impression on the lung. So this is the fourth structure. Then along with that, I have got groove for right subclavian artery. Right now, these are the venous structures that we saw, right? So what are these structures? Is right atrium along with SVC, IVC with arch of 𝗂𝒂𝒂𝗃 vein. Then we saw an artery relation, that is groove for right subclavian artery. Then talking about other structures, can you make out? As you will be having trachea and some part of esophagus, right? So you have esophagus and some part of trachea that makes up the mediastinal aspect. Yes, so this is 5 and 6. Then I have got 3 nerves. Yes, I have got 3 nerves. 2 nerves have been given here and 1 nerve it's not been shown. Yes, I have got right vagus nerve, right phrenic nerve along with right sympathetic chain. So sympathetic chain is going to run along the entire thoracic column, right? On the either side of the vertebral column, you'll have the sympathetic chain running. So if you take the sympathetic chain also forms, the right sympathetic chain forms the mediastinal relation. Yes. So you have got 3 nerves. Yes. Then SVC and IVC, arch of 𝗂𝒂𝒂𝗃. So I have got 3 venous structures. Then trachea, esophagus, groove for right subclavian artery, then right atrium. These are the structures related to the mediastinal aspect or the mediastinal part of the medial surface of right lung. Yes. Now, talking about the left lung, I'll show you the lung picture in the next slide. First, let us try to understand all of these structures, right? Now, in the right side, what structure we saw is right atrium. Here, if you take, as we have got left ventricle. And what is the artery that is related with the left side of the heart? As it is aorta. So I have got arch of aorta, which forms an impression along with descending thoracic aorta. Yes, left ventricle along with arch of aorta and descending thoracic aorta. Right? Then if you take, I'll be having a subclavian arteries and the common carotid arteries. Yes, what I'll be having? Subclavian arteries and common carotid arteries. Then as usual, esophagus and some part of trachea. Yes, I'll be able to appreciate. Along with that, thoracic duct. There we saw 𝗂𝒂𝒃 vein, right? Here you will not have 𝗂𝒂𝒃 vein. Instead, you will be having thoracic duct. Then along with this, you will have 4 nerves here. There we had 3 nerves, 3 veins, trachea, esophagus. Then we had right atrium and subclavian artery. Here, if you take, you will be having left ventricle, arch of aorta, descending aorta, common carotid, subclavian artery, esophagus, trachea, thoracic duct, along with 4 nerves. Yes, what are the nerves? One is the left recurrent laryngeal nerve. Very important nerve. It has got a surgical implication. We'll be studying this in thyroid, right? Next is left phrenic nerve, right phrenic nerve. Whatever the nerves related to right side is right phrenic nerve. Then we saw right vagus nerve along with right sympathetic chain. Here if you take, you will have left phrenic nerve, left vagus, left sympathetic chain. So it will follow the structures that we saw on the right side. Along with that, what we are going to see additionally is the left recurrent laryngeal nerve. Yes, left recurrent laryngeal nerve. So these are the structures, right? Clear? Now, this next topic is root of lung. So this picture, I wanted you all to observe the impressions. Can you make out? This is the cardiac impression. So here I will be having the right atrium. And here if you take, I will be having the impression for the SVC, right? And here I'll be having the impression for IVC, the groove for IVC. Can you make out? Then here I'll be having, this is the groove for esophagus. Yes, this is the groove for esophagus, right? So I will be able to appreciate these structures. See, groove for 𝗂𝒂𝒃 vein, superior vena cava, right subclavian artery and the top. So almost I'll be able to appreciate all the impressions. So they can pin the spotter, right? So they will pin somewhere here, or they can, if it is a left lung, they will pin along the arch of aorta. They will ask you the impression lodged. Right, name the structure that forms this impression. So you have to first identify which is the side of the lung, and then you have to go. Here I would like to tell you a trick. Now the topic that we are going to see is root of lung. This please kindly follow in spotters. Okay, if some professors is seeing me, they will come and kill me. Observe the root of lung. Now this is the root of lung, right? It would have been dealt in pleura also. Yes, this is the root of lung. If the root of lung, which side is root of lung here? Yes, you would have guessed it is on the right side. So this is right lung. This side, root of lung is on the left side. So it is the left lung, right? So if spotter is being kept pinned here, you should not sit and blink whether it is right lung or left lung. Just see root of lung. If it is on the left side, it is left lung. Right side, right lung. Right? This is a small trick that I want to tell you. Now, what is this root of lung? So with that, the relations of medial surface is done. I hope you are all clear. Now coming on to root of lung. What is root of lung? Now, you all know, yes, this is the mediastinal surface. There are lots of mediastinal structures. And what is hilum? Again, it would have been dealt in which topic? Pleura yesterday, right? Hilum, it is seen even in kidney. Any organ, I can define hilum as an area where the structures will come in and out, right? Certain arteries can enter into the organ, some vessels will get out of the organ. So hilum is in any area where the vessels and the nerves are going to pass to and fro. So there are some mediastinal structures that pass to and fro from the lung. And this root of the lung, if you take, this is a pedicel. What is the meaning of pedicel? It's a small connective tissue like connection. So it's a small connective tissue that is going to get connected to the mediastinum. So from the lung, from the mediastinal aspect of the medial surface, you'll have a small pedicel that will try to get linked with the mediastinum of the thoracic cavities. That is called root of the lung. So this root of the lung, that is a kind of a connective tissue, which surrounds all the hilar structures and it extends downwards and establishes a connection with mediastinum. That is what is called root of lung, right? You need not get panic at all. Now, yes, so this is the root of lung. Now you tell me, which root of lung, right lung or left lung? Yes, this is right lung because it is towards the right side. And this is the root of lung of the left side. Please, you should not identify by this, but I am telling you for your easy convenience, I am telling you right side learn the right, left side learn the left. But please do not tell all these, right? They will ask you who taught you all this. You will say some guy called Karthikeyan in Agam webinars, then they will screw me up, right? So please do not do all this. This is all some basic tricks that every student follows, right? Now, anatomically, how will you identify root of lung, whether it is right or left, is through the structures. Yes, it's to the structures. Now, right root of lung, the root of the lung at the right side, yes, it will contain 4 structures. Yes, it is going to contain 4 structures. Yes, can you make out these structures here? Very simple. You have got epiarterial bronchus, hyparterial bronchus. So this is the bronchial artery. So there is a bronchus that opens on the superior aspect of the artery, hence the name epiarterial bronchus. And there is an artery that opens on the, so there is a bronchus that opens on the inferior aspect of the bronchial artery. That is your hyparterial bronchus. So I have got epiarterial bronchus, hyparterial bronchus. Then I have got pulmonary artery. Yes, this is my pulmonary artery. And I have got inferior pulmonary vein. I have got inferior pulmonary vein. Right? So these are the structures. So usually if you take how these structures will be arranged is you will be having from the above downwards, first you will be having a bronchi, followed by an artery, followed by a vein. In your textbook, they would have given it as from before backwards, that is from down to up. If you take the acronym that you would have given as VAB, which means inferior most you will have a vein, then you will have an artery, then you will have a bronchus. But what happens with right side is the bronchus divides into 2, right? So if you take, this is the artery, pulmonary artery. So the bronchus above the pulmonary artery and the bronchial artery is, that is the epiarterial bronchus, and the bronchus below the pulmonary artery and the bronchial artery is called as the hyparterial bronchus. Whereas if you take the left lung, yes, it follows the same thing. Now if you take, you will be having pulmonary artery first. You will not have epiarterial bronchus on the left side. Okay, so it starts with a pulmonary artery, right? Then you will be having a bronchus. Then you have got an inferior pulmonary vein, right? You have got inferior pulmonary vein. So these are the structures that forms the root of the lung. So right lung root is formed by 4 structures: epiarterial bronchus, hyparterial bronchus, pulmonary artery, pulmonary vein. So you have to know this acronym BAV or VAB. You should be very cautious here. But here, since you don't have epiarterial, so it starts with pulmonary artery, then you have got a bronchus, that is the left principal bronchus here, and you have got a pulmonary vein, right? So this is what is the structures that form the root of the lung, right? Yes. Now, bronchial tree, why I wanted to include this slide is there is a clinical here, not on the bronchial tree, but on the division of formation. Now, if you take, what is this division of formation? What I am trying to talk to you all is, yes, this is the trachea. Yes, this is the trachea, and almost at the level of lower border of T4 or upper border of T5. Yes, lower border of T4 or upper border of T5. The trachea divides into primary bronchi, right? Now, this division, right, the division of trachea here, I call it as carina. Carina or whatever, right? It's a very important structure. That's the thing I included this, right? So you all know primary bronchus, secondary bronchus, tertiary bronchus, then you will have bronchioles, then you will have the alveoli. So till the terminal bronchiole, it's your conducting part, and from your alveoli is the respiratory or the exchange part. You all know this. Please know about carina or the carina. It is the bifurcation of trachea into primary bronchus. Yes, that's a very important thing. Now, if you look at the bronchoscopy, so this is the view of a bronchoscopy as it's a normal. So these are all trachea. Can you make out the tracheal rings here? Yes, these are the tracheal rings. Yes, this is the trachea, and this is the level of lower border of T4 or upper border of T5, where the trachea bifurcates into right principal bronchus and the left principal bronchus. And at the division, you are able to make out a ridge-like structure. Yes, you have got a median ridge exactly at the center. You have got a median ridge. This median ridge is what is called as carina. It's very beautiful. Now, why did I include this slide is because if a patient has got bronchogenic carcinoma, if he has got carcinoma of the lung at the bronchi level, is what will happen? Is what you're able to observe here is there are some swellings, is there are lots of local inflammatory reactions, there are swelling, yes, fine. Where is carina? What happened to it? Is very important. If a patient we suspect to have a bronchogenic carcinoma and I do a bronchoscopy, the carina's position would have been shifted. Even in this slide, I am not able to see carina at all. According, as of my knowledge, I am not able to see carina. I am not a good bronchoscopic surgeon. But yes, to my knowledge, I am not able to appreciate carina. So when I am not able to appreciate the exact position of carina, like this picture where I've got the median ridge, then I can suspect bronchogenic carcinoma. Right? I can suspect, I do not say I can confirm, I can suspect bronchogenic carcinoma. So understanding this point is very important. It's a median ridge, right? This is what I want to tell you from this slide. Next, blood supply. Again, because whenever I tell you, maybe in abdomen I would have told you, which will be coming in the next week. Any cancer, any tumor from an organ can spread to distant sites, that is metastasize by two routes. One is the blood route, another one is the lymphatic route. So understanding the blood supply and the lymphatic drainage is very important. So the blood supply, yes, we have already seen in the root of the lung, you have got bronchial artery. Yes, the bronchial artery, you have got right bronchial artery which supplies the right lung, left bronchial artery that supplies the left lung. It can be an MCQ question for you. Right bronchial artery, yes, it is a branch of right third posterior intercostal artery. Very, very important. Yes, right third posterior intercostal artery. And the left bronchial artery which supplies the left lung is a branch of descending thoracic aorta. Very important. You should not write it as intercostal artery. Only the right bronchial artery is a branch of right third posterior intercostal artery, whereas the left bronchial artery is a branch of descending thoracic aorta. And yes, another one is the pulmonary artery. What does the pulmonary artery do? Yes, it is going to carry all the deoxygenated blood, right? So from the heart, it is going to carry all the deoxygenated blood. It gets to the lung for oxygenation, right? Yes, you all know that, so I'm not going to get into the details. Followed by venous drainage. So it is going to follow the names of the arteries. So you have got the bronchial veins and the pulmonary veins. right? You have got the bronchial veins and the pulmonary veins. Now, why did I mention about the blood supply? Is because I told you the cancer can spread through the blood system, right? So if it is going to spread through the arterial route, that is involving the pulmonary artery, the bronchial artery and all that, yes, what happens from the lung capillaries? You all know the pulmonary vein is going to carry the oxygenated blood. So from the lung, the tumor is going to go via the pulmonary vein. Yes, we all know this. From pulmonary vein, where it will go? Yes, to the left atrium. From the atrium, it will get to the ventricle. From the ventricle, where it will go? Yes, it will get into aorta. From the aorta, what are the branches? Yes, you all know you have got a carotid branch, subclavian branch and all that. So it can get into the carotid artery from the aorta and reach the brain. See how beautiful. If you know +1, +2 biology and you all know pulmonary vein carries oxygenated blood from the lung to the atrium, yes, it becomes easy. Similarly, if you take the venous route, yes, it will be the other way around, right? Now, if you take the bronchial veins, as I told you, the venous drainage, you will have bronchial veins, and that bronchial veins also, if you take, you have right bronchial, left bronchial. Just go and see. Right bronchial will drain into 𝗂𝒂𝗃, left bronchial will drain into 𝗵𝒂𝒃. So I do not want to confuse you with so many terminologies. So what happens is bronchial veins will either drain into 𝗂𝒃 or 𝗵𝒂𝒃. So let us say 𝗂𝒃 system. So right bronchial vein is, it drains into 𝗂𝒃 system. From the 𝗂𝒃 system, it will enter into the venous plexus. Then you all know from the venous plexus, it enters into the dural venous sinuses in the brain. And finally, it will reach the brain. So this pathway we will very often mention in stomach carcinoma, in prostatic carcinoma, in uterine carcinoma. We will say that there is a venous plexus called as the vertebral venous plexus. Right, so any tumor surrounding the vertebra is through the venous system. It can enter into the vertebral venous plexus. From there, it enters into a dural venous sinuses. Again, a very important question in your head and neck. So it's actually a venous channel that will drain all the venous blood in the brain. So from there, it will enter into the brain. So this is how the tumor, it spreads through the blood system. Yes, very good. Now, the last topic, a very, very important short note. Almost every year it appears in the university exam. If you are going to give your internal on thorax without bronchopulmonary segments, you cannot have a question paper. Yes, it carries so much of importance. Now, this is the picture that is given in your textbook, right? And they would have told you a lobe is divided into so many segments. Now, what exactly happens inside the lung? So I am going to cut open the lung. Can you make out, this is the hilar structure here. Yes, this is the hilar structure, and I am able to appreciate a triangular or a pyramid-like structures here. Yes, can you make out? Yes, definitely will be able to make out. Right? You want me to do with yellow color? Let me do it with yellow color. I have no issues. Provided you have patience to listen. Please, can you listen to this bronchopulmonary segments? Okay, if I would have bored you from the beginning, just have a pause here, then come back and listen to bronchopulmonary because it is very important. So these are the bronchopulmonary segments. So this portion is what is being given in your textbook like this, right? So if you take, it has got some vessels, right? If you can make out here, it has got its own blood supply, venous supply, lymphatic drainage and all that. So what is this bronchopulmonary segment is? Yes, you all know our right lung has got 3 lobes, left lung has got 2 lobes. Each of the lobe of the lung is being divided into so many segments. And each of these segments has got its own blood supply, its own venous drainage, its own lymphatic system and all that. So when they are bronchopulmonary segments, first important thing, why should I know about bronchopulmonary segments? I'll start with that. Usually our textbook ends with that, but I would like to start with that. Now, say suppose there is a tumor in the right lobe of the lung. Yes. Now, in the right lobe, say suppose it is being confined to a portion of the lobe. Say suppose this is, let us assume this to be the right lobe of the lung. I mean, right lung, superior lobe of the lung. Say suppose a tumor is confined here, right? If I do not have the concept of bronchopulmonary segment, yes, I have to resect the entire structure. right? I have to cut open till here. I have to remove this entire piece of lung. So the surgery becomes very difficult, and I'm going to damage all the surrounding structures also, which are normal. So in order to have a resective surgery, that is, I'm going to confine my surgery to a part of a lobe, right? Then bronchopulmonary segments are going to help. So this is a benign tumor. Say suppose it's a benign tumor which is present here. It is very essential to remove these two segments alone, leaving all these segments free. Right? I will do a checking whether it has been metastasized anywhere. I will do all this checking, and if I confirm that it's a benign tumor, it is very essential, or it is very sufficient to just remove these two segments. That is what is called resective surgery. So if you want to do a surgical resection, then bronchopulmonary segments is very important. And this is how anatomy plays a very important role in understanding surgery. Yes. Now, let us see some surgical points on the bronchopulmonary segment. So if they ask you bronchopulmonary segment, you have to draw this diagram and you have to explain certain points. The first point, as it is pyramidal in shape. Yes, before that, the first point, as it is a subdivision of a lobe of a lung. Just now I told you, right? Lobe is divided into so many segments, a subdivision of lobe. Then it is pyramid in shape. So pyramid, as it will have an apex and a base. So apex, if you take, it is directed towards the hilum. If you can appreciate this picture here, yes, this is the hilum and the apex is directed towards the hilum. Yes, apex is directed towards the hilum and base is towards the lung tissue or the pulmonary tissue. Then what else? Each segment, if you take, has got its own arterial supply. It is being ventilated by a bronchus. Yes, it has got its own artery, that is segmental branch from the pulmonary artery. It has got its own blood supply. It has got a tertiary or a segmental bronchus. And it has, additionally, it has got a segmental branch of bronchial artery also. Then it has got a pulmonary venule. So you have got a venous structure here. Yes. So that is the pulmonary artery, right? So you will have the venous structure here, which will drain, right? So if you take, it has got an arterial supply, a venous supply, a lymphatic drainage, and more than all that, it is surgically resectable. So I do not want to just vomit all the points given in your textbook that I memorized, but just know, as it has got its own blood supply, venous supply, lymphatic drainage, it is surgically resectable, it is pyramidal in shape, apex is hilum, base is related to the lung tissue. Yes. So we have to know how many segments are there and where it is located. Yes, that is very important. With this picture, I'll explain you. It becomes very simple. Please listen to at least this slide, right? Now, this is my superior. This is the right lung. Yes, because I've got two fissures, three lobes. Diagrammatically, I can approve this concept, right? This is the superior lobe. This is the middle lobe. This is the inferior lobe. Now, the superior lobe has got three segments. So the anatomists have done so many dissections of the lung, and they are able to figure out three segments in the superior lobe. So what are the segments? Yes, this one. What is this called? It is located towards the apex. So it is called as the apical segment. Yes, it is called as the apical segment. Now, this one. Yes, this is the apex. This is the base. This is the anterior border. This is the posterior border. So this is the posterior segment, and this should be your anterior segment, right? So the number one is apical, number two is posterior, number three is anterior. Now get to middle lobe. So I have got only two segments, 4 and 5. So what is 4? Yes, 4 is going to be lateral, and this is medial, right? So this is a little bit laterally located and this is medially located. So lateral and medial. Now get back to what? You need to get back to the anterior, right? Here the 7 is missing. 7, it is medial basal. Okay, and the medial aspect, basally it will be located. So if you take 6, it is superior, right? 7 will be here. It is actually medial basal, on the medial and the basal aspect, right? And this is anterior basal. This is lateral basal. And this is posterior basal. So 7 will be on the medial aspect, somewhere here. It will be that, right, on the underside. So 4 is, it is lateral segment. 5 is medial, 6 as it is superior. I told you, right? In the inferior lobe, this is the superior aspect. So it is superior. And all other segments are basally located. So all these are basal. So 7 should be medial basal, that is missing in this picture. 8 is anterior basal. 9 is lateral basal. 10 is posterior basal. Yes, clear? Yes. Now, left flank, yes, we have got only 2 lobes, superior lobe and the inferior lobe. So superior, if you take, you have got 5 segments. What is the first segment? Is again apical. So more related to the apex of the lung. So apical. And this one 2 is posterior. Now all these are located on the anterior border, but I have to be very specific, right? So yes, this is anterior. Name just anterior. Fourth one is superior lingular. Yes, this is superior lingular and inferior lingular. Yes, what are the names? Superior lingular and then inferior lingular. Now you might ask me a question, what is lingula? You did not mention about lingula at all, right? That is nothing but a projection along the cardiac notch. So if you see, the left lung will present a cardiac notch for the heart to fit, right? If you, I don't think I have got a gross picture for left side of the lung, but yes, if you take, this is the cardiac notch, and see, can you make out a tongue-like projection here? This is called as lingula, right? So the 2 lobes on the 2 segments in the superior lobe on the down aspect, you have got superior lingular and the inferior lingular. So lingula will be here, so it is superior to the lingula, and here it is inferior lingular. So apical, posterior, anterior, superior lingular and inferior lingular. Now can come to the inferior lobe segments. So if you take the inferior lobe segments, is what are the things that I am able to make out? First one is this is apical. Now 7 is medial basal, it will be similar to right lung. 8 is anterior basal, 9 is lateral basal, 10 is posterior basal. So almost is very similar to what we saw in the inferior lobe of the right lung, right? So these are the bronchopulmonary segments. So if a tumor is at apical part, is at this portion, I will just remove this segment alone, right? If it is at the anterior aspect, I'll remove the segment alone. So it basically gives me a surgical resection technique is becoming easy, right? So with this, I would like to conclude my class. I hope I made this session interesting. I made you all understand the basics. Now, whatever I have told you is a basic knowledge that you must carry for your clinical subjects, right? If you have any feedback, suggestions, kindly let us know. We will work accordingly. Thank you all. We'll meet you in some other video. Until then, take care. Bye.